That's where the word script comes in. That's what is decided when people are very small, maybe 4 or 5 years old. And then they don't quite know how to go about it, and I think that the next thing they latch onto is usually a fairy tale, which sounds like the way they want things to be.
You mean a real fairy tale?
The real fairy tale. And so very often we can find out what a person's script is by asking, what is your favorite fairy tale? And so as we walk around, they're looking at people. There are innumerable Prince Charming, Cinderella, Sleeping Beauties, Rapunzels, and youngest of 3 sons who's going to be smarter than the other 2, and like that.
Yeah. After all, she let her hair down.
What I'd like to talk about is the Rapunzel script, which is a little bit different. The case in question is a woman who got married and thought this guy's a loser, and someday the real prince will come along. She had been adopted by her grandmother when she was young, and her grandmother broke up the marriage and then made trouble when the boyfriend came along, who was supposed to be the real prince. And the result was that the girl began to have diarrhea, and she came to the therapist, and the therapist had a lot of trouble with her because she obviously didn't want to give up her symptom. However, what I want to talk about is the Rapunzel script in general. The story of Rapunzel is that she's taken away by a witch at birth and put in a tower without any door, and then she has to lower her hair for the witch to climb up into the tower. And then one day a prince comes by and he sees what's happening, so he says, gee, pretty good, so I'll try it. So Rapunzel lets the prince climb up using her hair as a ladder. And as the fairy tale in Grimm says, she consented to have him for her husband. And so he would climb up there, and she said, why don't you bring a little bit of thread with you every time you come, and pretty soon we'll have a ladder. So she collects a lot of thread, and then one day she says to the witch, pardon me, gee, you sure are lighter than the prince that climbs up my hair every day. And the witch says, prince? What prince? And then the trouble begins, and Rapunzel gets banished, and then the witch cuts her hair off, and the prince climbs up the hair as usual, but when he gets up there, the witch is there, and she puts his eyes out and sends him out into the wilderness, and he wanders, and pretty soon, being a few years later, he hears a familiar voice, and it's Rapunzel, and his sight comes back, and they live happily ever after. Now, at first sight, in the case that I mentioned, it looks as though the husband is not a prince, he's a loser, and the later boyfriend is the real prince. But if we think over the real script of Rapunzel, what's going on is that Rapunzel is really getting tired of the prince. So as soon as she gets tired of him, she says that to to the witch, and the witch, of course, knows it all along. She's not that stupid, but that's the signal, so she says, essentially, I'll get rid of him for you. So she sends Rapunzel out into the wilderness and takes care of the prince. Now, while listening to this case history in some detail, I was certain that this girl really wanted to end up back with her grandmother, and that's why she was hanging on to her symptom. And that's what Rapunzel really wanted. She wanted to get rid of the prince so she and grandmother could start all over again and con another prince. Then if we look at the prince's script, he's a loser because any winner who found a girl with long blonde hair that she lowers out of a tower and he climbs up and he loves her is going to get her out of there real fast, and if he can't get her out of there, he's going to give her a few hints like, better not tell the witch. And Rapunzel couldn't have been that stupid anyway that she didn't know what she was saying. So the prince's script evidently is that he's a loser and he wants to get into trouble, and so he arranges so he gets his eyes put out. So you have to be very careful in talking about patient scripts that you don't assume that princes are winners, because in the actual fairy tales they don't turn out to be very bright. So the moral is, when you think you know the patient's script, that is the patient's unconscious life plan, you have to be very careful that you don't make a mistake by being too naive. Does anybody have any?
How come Rapunzel had to go with all the princes?
Well, the main thing Rapunzel wanted to do was stay with grandmother and have a little fun in between, so she would pick up an occasional prince, like she would let her hair grow again, I think, and run through the whole thing over again. But always she has to have grandmother, because grandmother's her real protection from man.
Why is it that you had to go into such a complicated allegory as Rapunzel to explain what was happening in Elise's case?
What we're trying to do is predict the whole life course of a person, which can't be too simple. And what we find is that most people's lives follow very closely the pattern of a fairy tale. That's why fairy tales stick with people, because they're very meaningful in some way. And so Rapunzel may sound complicated, but as a story of a whole lifetime, actually, it's relatively simple. And so we feel that people really try to live out a fairy tale in all its details. The only difficulty is that the fairy tale ends where they get married and live happily ever after, and our problem is, okay, what happens after they get married? Which is not always that they're happy.
Do you feel this helps you to understand it better and to communicate it to your colleagues?
That's right. And also the patients seem to understand that very well. They can see, for example, the Rapunzel case that I presented, it was not the therapist's idea that this is Rapunzel. The patient said, gee whiz, this is Rapunzel.
Really?
And as though she could see that that's what she'd been doing all her life, and then she knew the rest of the fairy tale, and her reaction was, that's probably what I'm going to do, just what Rapunzel did. I'm going to end up in some kind of a wilderness, and my best boyfriend is going to end up in trouble, and it's all due to the old witch, who in this case was grandmother. So it's the patient, actually, who tells us, just as in all these things. For instance, the question of permission not to follow the script. The script is an injunction from mother or father at a very early age. And the question of permission was solved for me, not in my head, but by a patient. It was a gambler. And the question was, how could I induce him or somehow persuade him not to gamble? And he said, that isn't the problem. All you have to do is give me permission not to gamble, because I feel that somebody in my head is telling me I have to gamble. And that was a revelation to me. I sort of sat up in my chair and said, wow, this is interesting. And then by listening to other patients, I discovered it's not that I have to tell them what to do. I merely have to give them permission to disobey let's say, the destructive orders which were given to them by one or other parent. And we know a lot about how the parents work. For instance, it is the parent of the opposite sex who tells the child what to do at a very early age, and the parent of the same sex who shows the child how to do it. One of our classical examples is the beautiful girl. Now, a beautiful girl, in our way of thinking, is a girl whose father gave her permission to be beautiful by saying, you're beautiful, I like beautiful girls, your mother's beautiful, that's what I like. And then mother shows her how. That means mother shows her how to dress, how to act, how to walk, how to be a girl. And inversely with a man. Mother says, this is what I want you to be, and father shows him how to go about being it. And this principle seems to work very well. So that's why if we can find the fairy tale which somehow is the story of the person's life, or if the person can find it themselves, then it really gives them a feeling that they know something about where they're going and what has to be headed off.
I think the music has finally gotten to me. I can no longer hear you anymore.
Yeah, what a noisy here.
Well, contribute to real love between a man and a woman.
Well, that we don't pretend to know, because Usually people who are capable of real love don't seem to end up coming to psychiatrists. They seem to be finding their own happiness, and they don't have to...
Well, Dr. Berne, where do you expect transactional analysis to go?
Well, I think that someday somebody is going to discover what human living is all about. For example, my feeling is that Freud set the foundation. I think that we have built something on the foundation. Sometime in the future, somebody will build, let's say, a third story on what we have done. And I think the answer is in scripts. That is, the the plan for a lifelong career which each person acquires at a very early age, maybe 4 or 5 years old. It may not be too specific in grown-up terms, but in general, it's like, I will be a success, or I will be a failure, or I'm going to end up killing myself, or I'm going to end up killing somebody. So by finding out a person's plans for his whole career, his whole life, and in careers we include such things as failure, ending in suicide, ending in psychosis or confinement in a state hospital, that if we can get in there and break that up, then we can really change a person's whole life course, and we feel we might really have found a very valuable secret of human behavior, a very long-term secret, which involves not only the person, but also his children. If we can break that up, we're extending the treatment into future generations, which of course every psychiatrist would like to do. If we can find a way to counteract the instructions people receive as very young children as to how they go the rest of their lives, but then we will really have something very valuable.